While some have welcomed the end to the country's mask mandate, others say they'll continue to mask up, while some healthcare professionals have raised the alarm, saying the country's decision was ill-advised. So it was an accessory that we could all get used to. While it may have been an easy adjustment for some, it did pose a bit of a challenge at first. Whether crisis or opportunity, others saw a gap to help while cashing in. This company started making protective gear at the height of the pandemic.
Legislation of the no more wearing mask regulation that was updated recently, because definitely there's going to be a negative impact on our business, but we don't know the extent of the impact yet. However, I have to say that our target has always been supplying to medical facilities, so we don't envisage a significant impact further.
On the ground, there is a mix of relief and fear.
Wearing a mask is convenient if you're in a building or indoor spaces.
Well, she says it's still not safe. Well, he says he does not believe that the virus is totally gone. He says when they're in crowded spaces, he believes everyone should wear masks. She says it's still too early to let go of the mask. He says he's comfortable wearing his mask all the time. He also says he wears his all the time. However, the Solidarity Doctors Network has raised some concerns.
The dropping of masks in the middle of winter is not the brightest idea that one can think of. We are seeing a lot of COVID, a lot of flu patients, upper respiratory tract infections. It's all viral infections that's going around. It's the highest number of upper respiratory tract infections and flu-like infections that we have seen in private practice at primary healthcare level for the past 2 years. So to just announce that, the scrapping of the masks during this time of the year doesn't really, without really giving guidance to the public out there and saying, listen, if you want to drop and don't want to wear your mask, you need to understand that there will be certain places, like in certain areas, as in the mining industry, as in public health facilities, that due to public health facilities, due to the type of work and the risk of infection, that you might need and be asked to wear your mask going into those facilities, and that it is not, you should not assume it is your right to automatically walk into such places and say, I'm not going to wear my mask. You might be asked to wear your mask.
So you love them or hate them, it appears that masks will still be around, and only now it's up to all of us to decide whether to use them. Griselda Lewis, SABC News in Johannesburg.